Good afternoon, everyone. Thanks for joining us. We'll give it a couple minutes to get everyone into the room here. Good afternoon again, everyone. Thanks for joining us. We'll give it another minute to get everyone into the room. We'll give it about 30 more seconds to get everyone into the room here. Well, good afternoon, everyone. Thank you again for joining us for our weekly Wednesday webinar series. Today's webinar is on NHF and WFH women's initiatives. My name is Brett Spatale, and I'm the Vice President of Advancement here at the National Hemophilia Foundation. At any point during the webinar, if you'd like to ask a question, please use the Q&A feature at the bottom of your screen. We have NHF staff members monitoring these questions, which we will pose to our presenters after the presentation. This webinar is being recorded and will be available to the community beginning on Friday, October 15th. And today, for the first time, we will be live streaming on our LinkedIn and YouTube channels. I'm joined today by Michelle Witkop, Head of Research at NHF, Kate Nammacher, Vice President of Education at NHF, and Dawn Rotellini, who wears two hats today as the Chief Operating Officer at NHF and Board Member and Chair of the Women and Girls with Bleeding Disorders Committee at WFH. Thanks for taking the time to join us today, everyone. And Michelle, I'll now turn it over to you to get us started.
Thank you, Brett. So I'm going to start with NHF's research initiatives for women and girls and those with the potential to menstruate. And we're going to talk about transforming the science in these women's initiatives. And I want to start out with our recent State of the Science Research Summit, and just mention that that was supported through a grant from the National Heart, Lung, and Blood Institute, the NHLBI, and this is the grant number. And before we really get into this, I do want to bring attention to NHF's mission. Our mission is that we are dedicated to finding cures for inheritable blood disorders and to addressing and preventing the complication of these disorders through research, education, and advocacy, all the things we're going to be talking about today, and ultimately enabling people and families to thrive. That's what drives us and brings us to work every day. So when we talked about the State of the Science Summit, this began a long time ago, 18 months or so ago. What Dr. Valentino really wanted was to bring the community behind in developing a research culture and moving research forward as a unified group. We really wanted to align our focus, what our priorities should be in research, and then again, move that forward collaboratively as a community. So how did we do that? First, we started, as I said, quite a while ago, June of 2020, with focus groups looking internally a lot. We called it the Blue Sky Initiative. So these focus groups were smaller, but still a good amount of people from the community asking if there were no constraints on time or resources, what do you think would be possible? What matters most to the community and to NHF, and what should we look like in 2030? And so we took that information and then we built it even bigger. We went national even more. We took that and had bigger listening sessions, again, starting with the community, starting with our people who were affected with inherited bleeding disorders, with their family members, chapters, other patient organizations, advocacy organizations who work with the community, and then ask them very similar questions. What in research do you think is missing? Where are the gaps? Where can the community be involved in this? And how can we move this forward? We took that to our healthcare providers, had listening sessions with them, and asked them, gave them that information, asked them similar questions, and asked them to rank what we had heard from our consumer, or what we're now referring to as our subject experts, because they truly are. They're the ones that are walking that path. This is their journey. So they're truly the subject matter experts, or SMEs. So we asked them to take that SME information and rank it. We then took it to our industry colleagues and did the same thing too. So we tried to get a very full view from the community, understanding what research should look like, what our priorities should be, where the gaps were. And then we really tried to distill that information. Finally, in January of 2021, all of that information we put together in a chapter survey. And our chapters then sent it out to their community. And we asked them to rank that information. So all of this stuff from our focus groups, our listening sessions, we distilled that down, and then we asked the community to rank it. And that's how we got to where we were. Now, when we think about the scope of the listening sessions, I just want you to understand that we really paid attention to the gender, ethnicity, race, and then because we're talking about research, even though we were looking at wide ranges of research trials and looking into therapeutics and pharmacology, we really wanted to understand what kind of experience we're looking at that too. And you can see there was quite a bit of diversity there. What it came down to were we were able to put into basically 3 buckets. And I'm not going to get into all of these buckets today. This is something many of you may have already heard, but we're going to really focus on that second right now. The first bucket was themes across all inherited bleeding disorders for research. But the second bucket is about women. And what we heard over and over again was that women were not being heard. Women were not being validated. They were not being seen. And that when we talked about things like Willebrand's disease, there was a lot of new therapeutics out there for hemophilia. But when it came to von Willebrand's disease or other rare bleeding disorders, there really weren't any new therapeutics out there for them. And when we looked at things like the impact of the symptoms and the manifestations of those symptoms across the lifespan as women aged, there wasn't any real research evidence behind that. We were hearing that there was joint disease in women. And many of you will be going, yeah, we've been saying that for a long time. But there's not a lot of evidence to back that. And so what we need is research in this area. We're seeing that in hemophilia carriers, we're starting to see more and more evidence being built, but not necessarily in von Willebrand's disease and other rare inherited bleeding disorders. And so there really was a call out to be inclusive of women as we moved through the State of the Science Research Summit. From all of that I just spoke about, we developed 6 working groups. And in our initial discussions, we knew that we would have those first 3, which really looked at the disorders, hemophilia, von Willebrand's, platelet dysfunctions, and other mucocutaneous inherited bleeding disorders. So that's Ehlers-Danlos, that's your HHT, those capillary type of disorders. And we have our ultra rares. And then 5 and 6 is looking at not necessarily the disorder, but the other things surrounding research that we really need to pay attention to. Diversity, equity, and inclusion. We need to look at health services research, implementation science, and then our infrastructure. We really want to look at how we can develop that research culture. And to be honest, when we first started, we didn't have group 4. But the discussions of the steering committee and our executive and planning committee were all of the things that I had just talked about. We were hearing that women weren't being heard, they weren't being validated, they weren't being seen. And while all of those groups would include women, we didn't feel that it would really give women's research the justification that it needed. And so in the discussions, it was determined that we really needed to have a working group that focused solely on the research priorities for the health of women, girls, and persons who had the potential to menstruate. And so we're looking at transgender, really trying to get to those invisible groups. So that's where we came up with our 6 working groups. And we feel that it was a really good decision to make that inclusion. And when we talk about this, I also want to say that for this group, they didn't just look at menstruation. They were given a charge, and all of the working groups had a similar structure to their charge in that they were asked to look at multidisciplinary clinical trials and then also basic and translational research trials. But for this specific group, they were asked to look at, the multidisciplinary clinical trials, and including things like therapeutics, implementation science, things that might be in another working group, but would cross over to this, as I had mentioned. The natural history of data collection across the lifespan for disorders for women, and looking at hemarthrosis and joint disease in women, looking at defining the severity of bleeding disorders and the phenotype of bleeding disorders in women. And when you come over and look at the basic and translational science side, you see sex and gender-based biology. How does sex and gender affect the inherited bleeding disorder across that lifespan? As a woman ages, how does her inherited bleeding disorder change across the lifespan? So all of these things were given as a charge to women with bleeding disorders. And this was really an important section. And I just really want to impress that upon everybody. So what came out of the state of the science? What were those specific research themes that came out? And again, I want to impress upon you, these aren't just for women, but women were included and were highlighted. So when we talk about bone and joint health, in the past, as many of you recognize, this was something that was discussed only about men. Now, we're talking about women. We're talking about how does bone and joint health affect women who have a bleeding disorder across their lifespan? And not just in hemophilia. What about von Willebrand's disease? What about Ehlers-Danlos? What about ultra-rare? How are they affected also? So we're trying not to be biased and just look at one disorder. We're trying to look at all of them. Again, what about that sex and gender on disease? And looking at all of these issues that you see in the bubble, not just the bubble, all of these bubbles, looking at diagnostic lab interpretation. As a woman ages, how do her labs change? And what does that mean on other comorbidities? What about access to care and access to appropriate referral as a woman ages? Those are important things that we really don't have knowledge about. Some of these things are important to research. Some of these things are important to advocate for, and some of these things are important for us to learn and educate not only ourselves, but others about. So, and there was a wide range of issues that came out of all of this. Again, looking at aging across inherited bleeding disorders, and how does that affect symptoms? How does it affect, again, lab interpretation, access to care? And what about as we develop other comorbidities as we age? How does that impact the bleeding disorder that a woman may have? How does not only the comorbidity affect the bleeding disorder, but how does the bleeding disorder affect the comorbidity? So those are questions we don't really have answers to, and we need to research them. Immunogenicity. Looking at that not only from hemophilia, but then also all of these other disorders, and including women in this research. Women have never really been included in research on things like inhibitors. So this is something that we should be including. And then looking at mental health, we recognize that it takes a village to raise somebody who has an inherited bleeding disorder. And what about those caregivers? Many of them are women, and many of them, those women, are carriers of a bleeding disorder as well as symptomatic. And now we're recognizing that it is not termed symptomatic, but they themselves have that inherited bleeding disorder. So what about their mental health? How can they adhere to a treatment plan when they can't even get access to care? When they can't even get a treatment plan? All of these issues are things that we need to start paying attention to. We need to start researching and advocating for. And then finally, pain. Personally, I did research the National Pain Study, and it was in hemophilia pain. We also gathered a lot of information on von Willebrand's pain, and there was a lot of information on women there. At the time, we didn't have the resources to publish that, and I am very regretful now that we didn't publish that information, because looking back, it was very, very valuable information about women, von Willebrand's, and pain. Now that is something looking forward that we need to consider it being inclusive of. All of these, again, these bubbles, all of these different disorders, and including women in this. What we're seeing in our community voices and research, which is our community registry, is that women are significantly impacted by the pain of menorrhagia, that it's impacting their social life, their work life, to a degree that we haven't previously recognized. So that's where we are with our research initiatives. And with that, I would like to be turning it over to Kate with the understanding that we have a lot to work on. And I hope that you in our audience will consider joining us as we research the solutions that are out there. Thanks so much.
Hello, everyone. I hope everyone's having a wonderful day. Really glad to be here. My name is Kate Nammacher. I'm the Vice President of Education at NHF. And I'm here today to talk to you about our education resources and updates for women. So if I can get my devices to work here, there we go. So what am I going to be talking about today? We have programming and resources and material for women who have a diagnosis of an inheritable bleeding disorder, for those who are undiagnosed but might have those signs and symptoms that we want to do outreach to. And I want to share a little bit more about some of the work we're doing to keep women at the table, get those voices be heard on various different programs and working groups. So we have been doing a lot of webinars. We're all here in this COVID world together. But upon reflecting back on this past year, we're like, we have quite the collection, and we understand that maybe not everybody can catch some of these live when we have our Wednesday webinar series, or we have some of our conferences where we record the content. But we do have a lot of amazing speakers that have come on this past year to talk about women's issues, from gynecologic management for females with bleeding disorders to the pelvic floor, which I learned a ton about on that one. So many different topics, heavy menstrual bleeding, and really, just a great option for people to have a tool on demand. And there's some links here, and we can throw them in the chat after my talk as well. But really excited to have so many more resources available on demand for various topics related to women with bleeding disorders. I also want to make sure people are aware and familiar of victoryforwomen.org. Our Victory for Women program is sort of our umbrella program for, those within the community, creating those spaces for education, sharing of experiences. Michelle really touched on that feeling of not being heard, and this is one venue for people to come together and at least feel validated with each other, come up with some action plans and just learn what's the latest, right? So victoryforwomen.org is one of our places where people can do this, and it's a website that we have, and we invite you to actually join in the conversation. A lot of these posts that you see here, I pulled this about a week ago, so it's a little out of date already, are things that we've posted, but we very much invite stories from the community, and you can see those who've shared their stories on there. But what are the latest issues that women need to know about and hear? And so this is a great resource to come together and share and learn about what's coming up for women as well. We also have an offering of workshops. You can see in this picture, back when we were all together in person, we really hope to be able to come back together for more local chapter events in 2022 in person. So hopefully this will all come to be. But one of the topics that will be offered, the exact title still a little bit to be finalized, but we'll really focus on reproductive health, menstruation, and menopause. So we have always had our Victory for Women series and women's topics as part of our offerings for chapters, but we've continued to listen to chapter feedback and women's feedback to ensure that it's really meeting folks where they're at and their particular needs. So we're really excited about that one. So if you're a chapter leader, feel free to request that one, or if you're a community member and you want to make sure that that's happening, reach out to your chapter, see if they're doing a women's retreat or have a women's track at a local education day. We also have various print resources and or online, depending on how you like to view your print materials. Everything we have is in PDF version, but people can request them as well. And we are happy to mail them out to chapters, hemophilia treatment centers, or to individuals. So last year we were able to publish our Time to Talk Puberty Girls with Puberty book, as well as a parent companion or adult companion piece for how to talk to young girls about, sort of some of the transitions to come. I will say it's also really helpful, even if you've gone through puberty, and some of the older girls to reflect back and learn even more, right? Unfortunately, one of the things that, Michelle touched on is that these things aren't always talked about. There isn't always a ton of research. There can frankly be a lot of stigma about these. So let's start these conversations together. And this is one tool that you can have and use as a conversation starter. So really great resource there. We also have our new ultra rare fact booklet. While these are not specifically just for women, all of them really touch on any particular issues that might come up for specific conditions, maybe due to pregnancy and childbirth or during family planning. So I highly recommend that folks still check it out. We are really trying to expand our offerings for the ultra rare factor deficiencies, or platelet disorders, other conditions that really truly do not have as much by way of resources, but face a lot of challenges potentially, especially as women. Another core piece of really, and this also came up in Michelle's presentation around best serving women in our community, is talking about mental health. right? And the impact Michelle noted of living with a bleeding disorder on time away from work or school and other mental health impacts, right? This is pain, for example, right? Really critical. And so we've actually been working together with the Hemophilia Federation of America, HFA, on the Together project to really try and address mental health across the community, but definitely there will be some programming and opportunities for women specifically. In addition, we had mental health sessions at our bleeding disorders conference, sort of sprinkled through all of our tracks, and we have some specific to women. So again, once those are all live on our website, or you can even check out last year's, those are also still available because it's a real important component. But if you like to follow any of the national organizations on social media, we will be continuing to really make sure that this is another area that sometimes there's stigma around, and creating spaces for conversations, information, and education on mental health and the impact. So please do follow and join. Now I'm going to shift gears a little bit to the undiagnosed. How are we reaching those who might be living with bleeding disorders, definitely living with these signs and symptoms, and don't necessarily know it, right? And we hear this a lot from women. You know, some of the research shows it can take many, many years from their first symptoms to actually getting a diagnosis. So how can we start to shrink that, right, as a community together? So we have our Better You Know campaign. It's part of our cooperative agreement with the Centers for Disease Control and Prevention. And we actually just came to a close in 2020 of our 6 years together working on that, where we developed the program and initiative. So I just wanted to share a little bit of the outcomes of that. As you can see, we have a website, our Better You Know website, and from that we had a risk assessment tool. So women who might have some of these signs and symptoms could go on. It's like 11 questions, very simple, and understand if some of their signs and symptoms might be due to an underlying bleeding disorder, and then head them on the path. Get them the right resources, tools. Who do they talk to next? What should they think about? Plan and prepare, all of those things in advance. So over 5,000, a little 5,500 here, women did take the risk assessment tool. It's available in English and Spanish. And of those, 80% were actually, when they went through that screening tool, showed that their signs and symptoms could be due to an underlying bleeding disorder. So we are reaching the right folks. Now we just want to make sure they're continuing on that pathway of getting the support and to a diagnosis with whatever their symptoms actually are for, and getting that treatment and care. And that's what our new cooperative agreement is really focusing on, that next step. But of some of the women we were able to follow up with, a much smaller sample, you can see half actually did take steps towards learning more about their risk. 40% had spoken to a provider about their symptoms. 23% actually got a test for a bleeding disorder, or one of the many rounds of testing, and 13% were diagnosed with a bleeding disorder. So we did not do this alone. We had community members, we had healthcare professionals involved, and it really, together we can make a big difference on some of these things. Which is my point here. We can all educate, inform, and inspire too. These pictures here are actually of our Better You Know advocates, a group of volunteers that we trained in early 2020 to go out and be in the community, or be working the social media angles to spread the word about, signs and symptoms of bleeding disorders, and really ensure that more people can get a diagnosis and better treatment and care. So our advocates are still out there, but we have a lot of resources and tools that anyone who's on this webinar or others would be welcome to use. They're all on betteryouKnow.org. I'm going to highlight just a couple quickly here. This is a postcard that has just check boxes. Do you have any of these signs and symptoms, and a little information? And these can be used, so if you're having a conversation with someone and they mention something like this, you can hand them a postcard. I was driving up to a Girl Scout event, and one of the other moms started talking about her bleeding, and I was like, I have a website for you, right? Any of those tiny little moments, we invite you to join us in spreading the word. We also have materials to actually educate and give information to healthcare providers. We know that is a critical component. Women often maybe have never even heard of a hematologist, nonetheless know how to get to one for, the most accurate diagnosis. So they're first going to go to their primary care physician or an OBGYN potentially. So we have resources and tools that talk to those types of providers about the different steps of determining risk and then coordinating care. if that's not up your alley and your cup of tea and you're more an audio person, you could share a podcast or a Facebook Live. We've been on a few podcasts over the past year, and we also have some Facebook Live events coming up in partnership with Healthy Women on November 10th and 17th. So if you want to hear from the healthcare professionals or the women that are impacted, we invite you to join us, and that might be an easy thing to share with a friend or somebody that you might know who might be going through any of this, and might be the way that they learn and make that connection. Then finally, I just wanted to touch on the importance, and Michelle really touched on this through the subject matter experts as part of the State of the Science, that, this is, really driven by the women in the community. And so I wanted to highlight a few things. We have been working harder, every year to ensure women's voices are helping to plan, create the agenda, be at the table, all of these things. So all of this CDC work, we have consumers on our women's working group, on our bleeding disorders conference planning committee. We have a whole women's track, and there's women creating that content with us every single year. We have fairly new for MASAC. We've always had a consumer representative, but making sure we have both male and female consumer representations on MASAC, and ensuring that we always have an OBGYN to ensure that there's also the healthcare professionals representing some of the key issues that women face. But there are many, many amazing MASAC, our Medical and Scientific Advisory Council, many that are huge advocates for this women's work. So I'm really excited we have a strong group there. And then another example of just sort of continuing to keep women's issues on the agenda is our policy team recently submitted a National Institute of Health request for information about sort of like what are the main issues or gaps for women as they were putting together their Women's Health Consensus Conference, and literally submitted pages and pages specific to women with bleeding disorders to ensure that when we're talking about women in health, right, that bleeding disorders are continually on the table at a national level as well. So with that, I thank you. I have my email in here if anybody wants to follow up with any questions, and we'll have a little time at the end. I'm going to hand it over to Dawn.
Thank you so much, Kate. Let me share my screen. All right. Okay, looks like we are ready to go. Thank you very much, both Kate and Michelle. Actually, I wrote down so many things from both of your presentations. I'm excited to take it back to the Women and Girls with Bleeding Disorders Committee. I am so happy to be here to present to you a different side of things. The World Federation of Hemophilia, Women and Girls with Bleeding Disorders Committee. I'm a WFH board member along with working for NHF. And so Brett's right, I wear a couple of hats. So let's get started. I really did want to give you an overview. Not everybody's aware of sort of the origins of the World Federation of Hemophilia. So I wanted to be able to share with you a little bit about them. They were established in 1963 by Frank Schnabel. He was a Montreal businessman born with severe hemophilia A. And his vision, as he stated, was to improve treatment and care for the hundreds of thousands of hemophiliacs worldwide through a new international organization. Well, what's exciting about that is that he was working with a group of leaders from different countries, and NHF was actually one of those founding members of WFH. There were representatives from 12 countries: Argentina, Australia, Belgium, Canada, Denmark, France, Germany, Japan, the Netherlands, Sweden, and the UK, along with us. Today, as you can see on the map, there are 147 national member organizations that belong to or are members of WFH. So while Mr. Schnabel's idea was for hemophilia only, of course we've evolved. And now it is, you'll see that all the time from WFH, it's treatment for all. And that means women and girls with bleeding disorders. So a little glimpse about WFH's programs as well. Many people know about their humanitarian aid program, which is vitally important, but also there's the World Congress and meetings and trainings, a really big investment in data collection worldwide and research, educational resources, safety, and patient and healthcare development programs. So it's really an integrated approach. It's the national patient organizations, or NMOs, were the national member organizations, medical practitioners, government, and really in the heart is patients or people with bleeding disorders. So that brings us to the actions of this committee. Up until 2018, there had never been a committee for women and girls with bleeding disorders at the World Federation level. And so we really, at WFH, really recognized for years that women and girls with bleeding disorders had been underserved, felt invisible, often experienced either incorrect diagnosis, late diagnosis, or no diagnosis at all. You heard from Dr. Witkop's presentation the same things, women sharing that they are not feeling heard, not being validated, not being seen, and that ultimately we're not just about menstruation, that we have other parts of our bodies that also do bleed. And so as a result of these consequences for women and girls living with hemophilia, VWD, and other rare disorders, it has really been a severe impact on their quality of life. And so created in 2018, I'm very proud to be the first chairwoman of this committee. The Women with Bleeding Disorders Committee was created. Now, we've also even evolved since 2018, and we've included girls specifically, because we believe that if you don't call it out, it doesn't happen. So our mandate from WFH as a brand new committee was to make recommendations on pilot programs or target areas to increase visibility for WFH initiatives on women with inherited bleeding disorders. Also to review existing WFH resources and recommend areas to expand training on our educational materials and to create web-based resources for women and girls with inherited bleeding disorders. They want to absolutely start including women purposefully in their data collection, and that will help us to identify needs and hopefully to also achieve treatment. And then provide a professional development workshop proposal to be reviewed by the Congress Program Subcommittee, as well as provide expertise and advice for multidisciplinary and special track sessions at Congress. So here's a bit about our journey. You can see in 2018 that that's when we were created. There were certain potential components that they wanted us to brainstorm on. We had our very first virtual summit that I'll share a little bit about with, and then our first full global summit on women and girls with bleeding disorders. And then in July of this year, we had our second annual summit. So a little bit about our incredible committee. This fully has been an amazing, engaged group. As you can imagine, as you see where the women from across the world are located, this takes true dedication. We're all in different time zones. In fact, this morning at 8:30 a.m. my time, and 1:30 a.m. in Lauren's time in New Zealand, she was on that call with the rest of us planning our sessions for World Congress in 2022, which I'll give you, that's a little hint, but I'll give you, that's a little precursor. But, it was really, really important for this committee to be represented throughout the world and not just centered in the United States or Canada or in all developed countries. It was very important for us to have all voices. So our first initial actions really was to broaden the scope of the work of WFH to just start including women and girls. Our first assignment was to develop one educational session during a virtual summit. And where we went was we created a session that was the impacts of challenges of bleeding disorders in women and girls, and how to improve care of women and girls with bleeding disorders. So we started brainstorming, we had great discussion, and after planning just that very one session, we had a whole laundry list of other topics that we really wanted to be able to supply. So as you can see, that's actually what led to the first global summit of women and girls with bleeding disorders. Our first committee actions, like I said, this was a 3-hour session for pre-Congress. Well, then the pandemic hit and we didn't have Congress. We were able, though, to have some sessions at their virtual meeting. And this really included the diagnostic dilemma. Again, going back to what Michelle Witkop said, that we're more than menstruation, that global priorities and the care of women and girls with bleeding disorders was very important. And We talked about advocacy, empowerment, and treatment options. So WFH is fully supporting our work in this area. These are just some top level things that we're really trying to accomplish. Inclusion of women and girls with bleeding disorders in all trainings, making sure we call it out. Inclusion of women and girls with bleeding disorders at the national member organization level. Outreach efforts in countries to help identify patients. This is all about data collection. I'll give you an example. I worked with Zambia, and I was listening to a presentation, and they said potentially they would have 160,000 women and girls with bleeding disorders in their country. 5 are identified and diagnosed. And so this is an area that they are working on to try to do outreach efforts to identify more patients and overcome some of the stigma that comes with being a female and bleeding in some countries and not being able to talk about it. So there's also a VWD initiative program. There's a creation of our summit that was dedicated just to women and girls. And then there's also a special webpage where women can share their story with the world. And so these are some of the macro objectives. We would really like to create a women and girls initiative. And it's something that we'd love. We're actually going to be working on this to hopefully launch at Congress next year. But here's the macro objectives, of course, are increase recognition, inclusion, access, visibility of women and girls with bleeding disorders worldwide. Increase the number diagnosed. You'll see this over and over again. This is a big job to do. Increase and enhance knowledge of healthcare professionals on comprehensive clinical management of women and girls with bleeding disorders. Enhance and build the capacity of those national member organizations to work with women and girls and for advocacy. And then foster collaborations with internal WFH committees and integrate women and girls with bleeding disorders into the other programming and the NMO development and other organizations and professional societies. So a little bit about our global summit this year. We had 497 attendees from 82 countries. What's really exciting about this, it was about 50% healthcare providers and 50% patients or people with bleeding disorders. And why that's exciting is that what's really spreading the word. The more we can do these kinds of things, I will say that while we would have loved to be together to plan a face-to-face summit and really build the community amongst ourselves, the benefit to this is that we had 82 countries attend this meeting. And there's no way we could have done that in a face-to-face environment. So the top ranked sessions were multidisciplinary care, importance of OBGYNs in a comprehensive care team, and a really fun's the wrong word, oral health session, but it was, have we bitten off more than we can chew? And I'll talk a little bit about that. The theme throughout the entire 3 days was hear our voices. And in one of the opening sessions, Baiba from Latvia shared that 1 out of 3 women in Europe with a bleeding disorder decided not to have children due to the impact of their bleeding disorder and the fact that they didn't have accurate treatment. It just wasn't acceptable. So here's where our speakers came from. They came from all over the world. Again, our goal was to be a world conference and not just dedicated in North America or in developed countries. So we had Australia, Malaysia, New Zealand, Pakistan, Egypt, India, the UK, Germany, France, of course, the United States, but and more, Brazil and Uruguay and South Africa. So just speakers came from all over the place to share their perspectives. This is just a little bit about the format. We really wanted to mix it up because 3 days of sitting in front of Zoom, we all recognize we're pretty zoomed out. So thank you all for being on today. And so I'll go into some of the plenary sessions. One of the highlights of the plenary session was Dr. Michelle Witkop from Ireland discussed with us about outreach and diagnosis and advocated for campaigns to drive awareness about heavy menstrual bleeding, such as Know Your Flow. And then she strongly suggested screening for all girls with heavy menstrual bleeding for a bleeding disorder and reminded us that bleeding assessment tools are not always sensitive to female bleeding symptoms. We learned that some women have normal factor levels, but abnormal bleeding scores. So that was a good eye opener, I think, for many. Some of the educational sessions included, as you can see here, the list. But on the topic of pain, Dr. Pamela Narayan told us that chronic anemia, which can be caused by heavy, untreated bleeding, is an underlying cause of pain. However, in clinic, this question about pain and then treating for anemia doesn't automatically come up in those visits. And that was an eye-opener. We had hot topic exchanges, and the hot topic exchanges were great. They were really an intimate setting where people could all chime in and have a full discussion. But I talked about the oral health. Have we bitten off more than we can chew? We aren't talking about just clean teeth, right? And healthy gums. What we talked about was that bad breath and oral bleeding impacts an intimate relationship. We talked about the fact that bleeding in the mouth is trivialized and kind of blown off, and it's ignored. But it has a major impact on everything from dental health to intimate relationships, but also to the rest of your physical health, and that we need evidence-informed protocols. And then there were the Ask the Experts sessions. A highlight there was that one of the suggestions that came from the audience was that to build an international resource list of experts for rare bleeding disorders for providers, so that if you are not typically seeing women in your center, or if you are not in a hemophilia treatment center, but you are an OBGYN, for example, that there would be a place to go to get resources if you found that you were treating someone that had really heavy menstrual bleeding, or in another case, with a healthcare provider that you might have somebody with major joint bleeding and you're trying to figure it out. To have those international resources listed somewhere would be super helpful. And finally, the Toolkit Sessions. We talked about one perspective, which I thought was really interesting. Siba El Masri shared that the perspective from a low middle income country, because there are no international protocols specifically for women and girls with bleeding disorders, there's a huge gap in comprehensive care throughout the world. So what we are working on now, I sort of gave you a foreshadow of this before. We are working on the very first track ever at WFH Congress for women and girls with bleeding disorders. Our committee's been planning 3 multidisciplinary sessions, 3 professional sessions, and 1 workshop with case studies. So more to come on that. I hope you join. It is in person and virtual next May. So you should, if you haven't gotten information from WFH, please go to their website. It is posted. And then I talked about some resources that were really needed. This is on the e-learning website of WFH. You can see the link on the bottom. We've developed frequently asked questions, which is a fact sheet, and it's in English, French, and Spanish. And so you can see some of the questions that are here, but we really are using that. We hope that this gets shared to primary care physicians, midwives, healthcare providers in developing and developed countries, and to explore partnerships through outreach, telehealth, and digital technologies. We really need to understand these transcultural issues to better serve women and girls. Finally, my big announcement, super excited. I hope that everyone that is on this webinar will share this with your community. We have the Susan Skinner Memorial Fund Scholarship. Now, this has been awarded to 22 women over the past years, but we have expanded the age group from 18 to 60 years old. So now there's this huge range. It was originally designed for young adults, and we just kept hearing from the community about the opportunities that they would like to see. So you can see that if you receive the scholarship, you're able to attend WFH 2022 World Congress face-to-face. The application period has just opened and it goes through November 15th. The link is on my screen. And I will tell you that the recipients have really been able to expand their knowledge and their community and their networking. The scholarship aims to cultivate leadership and promote engagement of women in the global bleeding disorders community by providing opportunities for education, training, and networking. And just a note about that, the Susan Skinner Memorial Foundation was created in 2007 in honor of the late Susan Rose Skinner. And some of you know Mark Skinner, that is his mom. So this is the scholarship fund that they created in honor of her. And then, the goal is that the scholars take away the skills and the confidence and commitment to advocate on behalf of women and girls with bleeding disorders throughout the community. As I said, 22 women have received this scholarship, and many of the scholars have maintained and even deepened their commitment to the bleeding disorders community. And they've all told us what a profound, life-changing experience this was. And you can see on the picture here, we actually have 2 NHF staff featured here. Nicole Scappi and Marley Wetton were both recipients in the past before joining NHF as staff. So with that, I know it was a ton of information. Thank you so much for joining us. I am going to stop sharing my screen, and then everyone can come on camera and we can answer questions if you have them.
Great. Thanks so much, Dawn, Kate, and Michelle. We appreciate a lot of information there. We do have some questions that have come in. I'm going to start at the top here, Michelle, with a question for you. How did you assure that you had a diverse and inclusive representation of people from the community in the listening sessions at the State of the Science? Oh, Michelle, I think you're muted.
As we reached out, we wanted to make sure that the people who were included were from different backgrounds, different educational levels, different socioeconomic levels. We reached out to people who were in community voices and research. We reached out to our chapters and asked if they had people who might want to be engaged. We had people who had verbalized interest. We had attached these listening sessions. Some of them, well, I'm sorry, I'm missing up my CVR ones with this. This we did virtual. All of the listening sessions for the SOS were virtual. So we actually worked with a company that helped us to look at all of those things. So as we reached out, people actually said, yeah, I'm interested. And then we made a list of all of these different things that we wanted to compare so that we could make sure that one session might be on ultra rares. And so we made sure that all ultra rares had different diversities. And then one on Willebrand's disease, and we would make sure we had men and women and different ages. So it was a very thoughtful process. It wasn't just, yeah, we're going to have a group and this is what we have today. There was a lot of thought put into people who were asked to and chosen to participate in those.
Great. Thank you, Michelle. I appreciate that. I'm going to jump around a little bit here and go to Kate next. Kate, one of the questions that have come in is, what have been some of the difficulties in providing education for women in the inheritable blood disorders community?
I mean, I think, the partnering with our chapters, I think, has been one of the greatest successes, because there have been these, formations of women's retreats and, local communities to come together. And I think the challenge then is like, who's not included, right? And how can we support chapters to ensure that those that aren't tapped in are being able to tap in both locally and then nationally, getting additional, resources and support that way as well. And obviously, a little bit still some of the stigma around it. It was interesting. I was on a conference last week, a national women with hemophilia and rare factor deficiencies. And, the women in the chat were also like, we don't need to just be having these conversations with just women in the room anymore. The men actually need to hear women's experiences. So what started as like, hey, we need these safe spaces so we actually can, come together, feel validated, come up with ideas on how to make change. And now it's like, we're ready to expand and ensure others are hearing us too. They need to know about heavy periods and things beyond menstruation and pain and all of that. So there's continued, work towards equity, really. So both successes and challenges all in one.
Yeah, that's a great point, Kate. Talking to ourselves about ourselves really isn't going to work. So that's wonderful. Thank you for that. I'll jump over to Dawn next. Dawn, a question that comes in. We often live in I love this question. We often live in a first world bubble in the US. What are some of the biggest barriers in more developing countries?
Yeah, thank you so much for that question. So in many countries, they still don't have access to treatment and care for people with hemophilia. And when I say still, and I mean it because WFH was created in 1963 to bridge that gap specifically. NHF was created 73 years ago to do the same thing. And it was really specifically around hemophilia. When we see that women and girls with bleeding disorders aren't included in getting diagnosed and treatment and care, it's not that surprising. And I don't blame the national member organizations for focusing on one thing first, because if you don't have access to care for any of your population, and then you want to add another whole population on top of that and try to tackle it all at once, it can be very, very overwhelming. So I think that the barrier across the world is that actually, Michelle really pointed this out. Women, so it's about being heard, validated, and seen. But in some countries, it's even more so because there's a very big stigma attached. In speaking with some folks, Megan, that many of us know in Nigeria, many times if a woman has a bleeding disorder, it is associated with witchcraft, or it is associated with something that you did so horribly as a woman that you are either bleeding or you've even carried this on to a child, and that this is the curse on your family for that action of that woman. As you can imagine, that doesn't exactly encourage people to share that they have bleeding issues and symptoms, nor even about their family members. So we have a lot of this transcultural challenges that we have. That is something that we're working with developing countries. How do you talk about bleeding in women without shutting it down? Even in families, it's very difficult for a woman with a bleeding disorder often to share that with the rest of the family. They just don't talk about it. So it's a very delicate, and I guess we just have to be extremely sensitive and understanding about the fact that this is their culture and we can't put our Western, attitudes on top of it. But I'll tell you, we have the same, some of those same issues are in the United States as well.
Michelle, did you have a comment?
If I may, yeah, I do. Dawn, I certainly don't have your knowledge, expertise, or resources, but some of the things that I look at with this is that we have period poverty here in the United States, where women don't have access to the feminine hygiene products and things like that. And I just think about other countries where their poverty is so much more profound than ours is. To your comments about the stigma associated with a bleeding disorder and with periods, and the thought that this is a curse, this is witchcraft, and all of those other things. And so all of it, there's so much to unpack with that. And there are so many layers associated with that. How do you even get to that they should be diagnosed, that they should be seen, that they should be heard? And then on top of it, that women in many of these other countries as a gender, even without a bleeding disorder, are not seen and heard. And so it just is, there's so much there with other countries.
And Michelle, thank you for that. And I know that we only have about 2 minutes left. And Brett, I don't want to hijack the next question, but I will say that that's why that global summit for women and girls is so important, because we were getting providers attending all over the world. And that's one step, because the family tree, that's one way to identify women and girls. That's, one of the easiest things to say in a family where hemophilia is diagnosed in a man or a boy, that, okay, there might be then someone else in this family that actually also has a bleeding disorder, and it's a place to start.
Great thing. And I do want to be respectful of everyone's time, but I do have a great closing question that I want to pose to each of you. It's a very broad and probably difficult question to answer, and I'm going to ask you to keep it to 30 seconds. So it's your challenge for the day here. But I'll start with Kate. The question is: in all of your work, what has inspired you the most?
Oh,
I know
so many things. It is hard, but I will keep to my 30 seconds. I will say this work through our Better You Know campaign, reaching undiagnosed women has been really inspiring, having women share their journeys, women who have a diagnosis, but how long it took, all of the hurdles and barriers, and how passionate these women are to make sure their peers out there, the next generation, doesn't have to go through it like that. That helps me wake up every morning and do this work, that I am so fortunate to get to partner with these community members to do this work.
That's great, Kate. Thank you. Michelle, go to you next.
I'm a provider also. I have been in the past, and to have really helped somebody and made a difference in their life and see that change, see that the difference that I've made, and the impact that sustains me.
And I was hoping you were going to draw on that from your previous lives. So thank you. Dawn?
Yeah, sorry, Brett. I'm trying to do it really fast because I know we're out of time. I'm going to take the global perspective. And one of the things that truly motivates me is the idea of treatment for all. It shouldn't matter where you live in the world. You deserve access to care and treatment and to be heard, and that you are not diminished, that you are worthy of that treatment and care. And so I am truly motivated by that every single day. That includes women and girls with bleeding disorders, but it also includes everyone with a rare disorder, an ultra rare disorder. And this is what I love what I do. I'm really lucky.
Great. Well, thank you, each of you. I know this was short notice, and no one would know if I didn't say that. This was really great, and we really appreciate your time, taking the time this afternoon to come and join us, and appreciate everyone out there watching us on our YouTube and LinkedIn channels as well too. We will expand that social outlook or that social broadcast as we move the Wednesday webinars forward. That'll be available, and you'll start to see that. Please note that this will be available on Friday, October 15th on the events tab at hemophilia.org. Once again, I don't want to take away from the fact that you guys just did an outstanding job today. Thank you, Dawn, Michelle, and Kate, for presenting to the community. We really appreciate your time.
Thank you, Brett.